And one does, I do want to go back to Paulette and ask if you have observed health impacts of the heart-healthy diet and the shift toward healthier.
At this time, we do not have objective data that indicates the benefit of the heart-healthy menu. However, I have personally just overheard comments from inmates just speaking about the menu, not knowing who I am and that I'm listening. And I have actually heard inmates speaking to other people and saying, you know what, I feel better, I breathe better since I'm eating whole wheat bread instead of the white bread, or since we changed from the whole wheat bread to the white bread, since I'm not having whole milk anymore, I'm having 1% milk, and I'm not having fried foods anymore. And these were inmates who have been in our system before, and particularly during the change, and the inmates spoke to that effect. And like I said, that's subjective because it was just a conversation. But I feel, the inmates in our system are not, they cannot go shopping. So they eat whatever we provide. And if we are providing heart-healthy food, I'm sure they're eating I know they're eating healthy. But like I said, we do not have objective information at this time, objective data to indicate the benefits of our heart-healthy menu.
So that raises a question that I kind of want to plant for all of the panelists, to think about whether there's research that you would like to see done. I'm not volunteering to do it, but to get the questions specified, if there is research. You don't have to answer that right now, but as we're conversing, think about whether there's research you'd like to have done that would strengthen the work that you're doing. Are people ready with questions? Okay, let's start.
This is a great panel. Thank you for bringing us together. I have a question about the waste and composting issues, especially because of the vast amount that does end up in the garbage from institutional sources, not just the detainees not eating all the food, healthy food on Rikers Island, but also in other situations, schools and the senior centers, et cetera. Thank you.
I actually can tell you that Lenox Hill, because of Grow NYC, actually was interested in composting. We looked at various units for on-site composting. We don't have the space for it at the moment, and Grow NYC put us in touch with the sanitation department, and we are shortly, it's only been delayed because of the weather in the last month, but we're going to be a pilot composter institution on the Upper East Side and with the Department of Sanitation. We're going to start small, though. We're not going to compost all of our raw food, but we're going to compost a certain number of cans a week and start there and then incrementally grow. And possibly at some point compost on site, but that'll be tricky.
Can you describe the composting facility at Rikers?
Yes, we have a composting facility on Rikers Island, and we compost from our 3 production kitchens on Rikers.
And don't you also receive waste, organic food wastes from some other parts of the city? No?
I can't describe that part of that section of the composting as far as the other parts of the city that the other parts are delivered to the compost. I can say though that we collect all the organic waste from our kitchens, and we have special containers set up for composting, and we work in coordination with the Department of Sanitation, and they pick up the containers on a daily basis and deliver it to the compost facility.
Good. Well, this gives me a chance to put in a little plug for the institutional meals report, because in the report are boxes, and the boxes are all the places where we thought some people would want to know more than most people would want to know. So if you're reading through for an overview, you can skip all the boxes, but if you're interested, for instance, in the waste management, there's a box on that. There is actually a box on
I
the...
can say one more
Right.
tiny thing on
Good.
that, is that I know that the Department of Sanitation also is starting a pilot project with the Department of Education for food waste on Staten Island. And that I think this is another area where there's a distinction between the centralized sort of food production and decentralized food production. So, for example, if the food service is coming from like a nonprofit organization that's receiving funding, city funding to produce the meals, that institution might have a little bit more autonomy about where how they deal with their waste. Whereas if the institution is in a city-owned building, they have more regulations that they would have to follow with their waste, although there are some pilot projects that are partnerships between the Department of Sanitation and the Department of Education or other agencies to do some composting. Actually, and I think it was the Department of Homeless Services, I think, also had some shelters, does some composting.
Thank you. This is really wonderful, and I look forward to reading the report. I'm curious from Lynn and Mr. Johnson, did you do any kind of education to get people to accept the new menus, and how did that go? And I know you said you had lots of opinions.
Yeah. Actually, we formed a committee just to plan the whole education process. And the committee comprised of myself, the dietitians, and the directors. And we started like I explained earlier, from the commissioner, the wardens, the deputy wardens. We went to the inmate council. We attended the meetings. We went to the inmates. We met with the correction officers. We met with the deputy wardens. So we started a very extensive educational campaign prior to the implementation of the food service standard. And we also had posters and flyers which we distributed. And with each step of the implementation, we actually educated them and gave them that information regarding what was next, what was going to happen. And we found that very, very effective in just getting people to accept the changes. And it also provided them with an opportunity to ask questions, and they have concerns. And so we had an opportunity to address their concerns, and they would take it back to the population. And because of that, we did not have repercussions.
We also, we're not that thorough, but we're mandated to have quarterly menu meetings with the seniors. So we have quarterly menu meetings with the seniors where anyone can come and they can make suggestions and talk about what they like and don't like. I have to turn those minutes into the Department for the Aging. We also, I also started a monthly nutritional roundtable the last Friday of every month, and we did it on a variety of different things, but the most popular roundtables were the ones where we cooked and talked about food and nutrition, and so I cooked a lot of the things similar to what we were putting in the menus. I mean, we're actually serving things like wheatberry salads, and we're using upstate grains. And many of the seniors had no idea what a wheatberry was. And we've served a lot of kale, just like everyone in New York City is eating their kale now. And it's we use a lot of the affordable New York State storage vegetables and winter vegetables. And people have lived on this food in New York State for centuries. We are going back to that. And I don't have quite as captive an audience as you have at the Department of Corrections. On the other hand, I mean, we do have, people go to senior centers because they need to, and the women in the homeless shelter are there. So all I can tell you is I've gotten a lot of anecdotal feedback because I'm in the senior center and at the shelter periodically and in the Head Start program. I've gotten a lot of feedback from the seniors, and it's been remarkably positive. And I think part of that has to do with the way they feel, and that's what they've told me, that it's, you can talk about eating something for a very long time, but then if you eat it for 2 years and kind of feel a little different, it's experiential. It's a completely different thing. And our numbers are up from 2 years ago, 27%. Now, you know, food is a lot more expensive, and there are a lot of reasons why people are coming to places where they can get free food. But still, I mean, more people are coming.
The proof is in the pudding, maybe. We have another question pending, but I have to take this. Our new catering source for the breakfasts provided us with whole fruit this morning, which you may have noticed. And if you didn't eat your share, be sure to take one with you.
Hi, thank you for everything this morning and all that you're doing. I'm most interested in food at schools, and obviously it's the biggest provider of meals and snacks. So I was wondering if anybody or buddies could talk a little bit more about what's happening with the quality of food and the freshness of food happening in our city schools, and also about costs there. It was very interesting to hear the number in terms of cost per meal without labor in the prisons, but also wondering that about schools, but more about the quality. Thank you.
I wonder if you might
All
want
right,
to answer
so maybe I'll try and take that on. It's interesting, I mean, we specifically didn't have someone from DOE on this panel because it's such a large part of the institutional meals picture that it tends sometimes to obscure the challenges and the innovations that are going on elsewhere. The sort of intentional reconstruction of school food in New York City began before the food standards that everyone has alluded to. And I should have said that in the introduction, that the food standards came in 2007. They were promulgated by a mayoral decree. You should look at them. They're fascinating. But school food had begun trying to move toward healthier, more appetizing, more appealing food and a lower deficit, more financially manageable food system in around 2004. And I think that's when the executive chef, Jorge Collazo, was brought in. The scale of school food in New York City is enormous. There are 1,700 schools. About 1,200 of them have cooking kitchens. Some of those schools are multiple schools grouped in a particular building. So they're, the Baird Rustin complex actually has 5 schools in it. But still, it's an enormous system and challenge. And people probably have seen the statistics, serves more meals than any other institution except the United States Army in the United States. When the new federal standards came in the Healthy Hunger-Free Kids Act that was passed in December of 2010, there was a 6-cent per meal increment that would be made available to schools as they could document that they complied with the new federal standards. Now, school food was already most of the way there because of the New York City standards and other changes they'd been making. But in order to produce the documentation they need to collect the 6 cents, and they are doing 650,000 lunches a day, about 850,000 meals a day total. So when at that scale, 6 cents a meal makes a difference. In order to produce the documentation, they had to eliminate what had been called menu flexibility, which was kind of manager's choice, the thing that introduced a little bit of the advantages of decentralized food planning into the school food system. So there is now less opportunity for parents to become effectively engaged in what is served in their school cafeterias because managers no longer have the option to make substitutions, not because they can't be done in ways that comply with the standards, but because the documentation is unmanageable in the current thing. So what we hear, and are there parents in the audience with children in the New York City school system? Grandparents, okay, grandparents and parents. You know, I think you could ask 24 parents and grandparents and get 24 different reactions, but the food has certainly been improving in both health and palatability over what it was, you know, a decade ago or more. School food in New York has become part of a national alliance, School Food Focus, which is working to increase the healthiness and sustainability of the food that's drawn into schools, including, for instance, a new emphasis on antibiotic-free or low antibiotic, what they call clean label chicken. There's a national chicken initiative run by School Food Focus that's trying to draw clean label chicken through the food system. And they are part of a smaller Great Cities Alliance, which has taken on as its first task getting biodegradable trays, plates. So back to your waste, the school food has been sending 3.2 million styrofoam trays a week to the landfill. Once we get the new biodegradable, that will be a whole new system. It requires, again, a big interface with Department of Sanitation because they've got to pick up the biodegradable things separately and get them to a composting facility. And am I answering your question?
Yeah, I mean, it's all interesting. I mean, I definitely am interested in knowing a lot, specifically about the healthfulness of meals, and also if we're seeing big disparities in different boroughs and neighborhoods. Are there issues at all with kind of the localities, as we know is the case for the general public?
Well, it's probably less than the disparities in supermarket access, in access to fresh produce. There are basically, there are 26 different menus for various specifications, some of which have to do with whether there's hot food capacity on site. But there are two basic menus, the default menu and what's called the alternative menu, which was the WITS menu, the menu developed by Wellness in the Schools. And Wellness in the Schools is a nonprofit that took on the challenge of improving school food by introducing culinary graduates into the school kitchens to work with the school food service staff. So one approach to trying to upgrade the food is to increase the reliance on the alternative menu, and that is something that parents can get involved in. Now I see a lot of hands. Let's go ahead.
Thank you. I think school food is healthy, but I think it's the other food that's provided in schools that we should be concerned with in terms of, fundraisers and celebrations and things like that. So school meals themselves are very healthy. I'm a parent of a first grader in public school, but it's the other food that is really concerning.
So-called competitive foods and foods. Okay, go to it, Sarah. You're pass the mic.
Thanks, everyone. My question is about labor, and looking at this list of agencies, I'm really struck by how the workforce is a result of some very specific policy changes, notably that came about as a result of the civil rights movement, 1960s and 70s. It's now a really important venue for people of color, and particularly women of color working in the city, that to overcome discriminatory issues within the private sector. So I see those policy victories now we're living with, and I'm wondering how the food policy agendas are interacting with, fair hiring and fair labor standards, which, we can be proud have advanced since the 1950s in this country. So,
good. How many people do you employ in food service at DOC?
Cooks, and the cooking staff is less than 200. It's we have inmate health They're not cooks. They assist. They assist the cooks, but it's less than 200 department-wide.
And there are more than 8,000 working in school food. You know, it was, again, difficult to get real hard and fast numbers, but one thing I can say is that if we took full advantage of these programs, if we had universal free meals so that more, I mentioned that school food does 650,000 lunches a day, but there are 1.1 million children in public school in New York. If we expanded summer meals to its full capacity, we could be generating additional jobs in large numbers, and they are union jobs, the jobs that people have fought for, so.
And can I just add
Yeah.
briefly? So I've been working on a separate but related project looking at food labor in a few childcare and senior settings around the city, and most of those jobs, as Jan said and as Lynn alluded to earlier, are unionized. They don't pay particularly well, but there are ways of advancing within the union. They do have benefits, but so far it seems like the benefits, especially the health benefits, have been eroding in the past few years. So I think it's important to pay attention to that.
And one other thing is that depending on the agency, some of the workers are city employees and are often unionized and some aren't. I think the Health and Hospital Corporation, as part of their food service system, has some vendor-produced jobs and some city jobs combined. You know, everyone's doing different things.
But I think attention to the labor impact is important. Okay, I think I see it. All right, we have officially 6 minutes left, so.
Try and fit in 4 questions.
Okay, my question is, I believe that the most important factor when deciding between centralized and decentralized sources of food is finance and money, the bottom line. So for the lion's share of these organizations, it's centralized. First of all, we would have to ask who are the main vendors, who are the big companies making the money selling to the DOE, to the Rikers, and we would also have to ask, movements like the Greenhouse, who gets chosen to be a part of the decentralized? Who are the vendors that are chosen to become vendors for all these organizations? And yeah, that's it.
It's a big business.
So-
It is a big business.
But in most situations, it's not a decision of the agency whether to be centralized or decentralized. It's sort of like that way the agency evolves. If it's for example, where the Department of Correction, that everybody is together in one place, so one central kitchen, that's more centralized. But for example, with senior centers and daycare centers, those are often nonprofit entities that receive city funding, so that ends up being decentralized. It's not, it's not one decision that's made. And there were programs that were put in place to help more decentralized organizations buy in bulk, like through Green Market Co. and there was one other program that's described in the
Essenza
report.
and
Yeah.
GPS.
Right.
Just a quick comment about the decentralized and centralized food production. We started out as being decentralized, and we decided to centralize our purchasing, our menu, our recipes. So as we were implementing the food standard, we were also centralizing all of these different functions. So by the time we were like in the middle of it, we had centralized purchasing, the menus, and also the recipes. And that actually helped us a lot in the control of everything.
I should speak to that too. I don't know that I even see myself in my job as decentralized, but it's just 2 kitchens and they're within half a block of each other. However, we just got funding to renovate one of those kitchens. It's going to be 2.5 times the size, and I'm going to move, for the most part, all of the cooking into that kitchen, And I am going to try and make all the menus serving the 3-year-olds to the 103-year-olds the same menu, or 90% the same menu, because it will be so much more financially efficient, and for ordering purposes and data control and recipes and everything she's talking about, it will be more efficient. It's still only 40,000 meals a month, but it'll be much more cost efficient. And for the cooks, it'll be way more efficient.
And I guess I'll just add briefly that I may have glossed over some of the nuance of the centralization versus decentralization in the interest of time, but as you can hear from Paulette and from Lynn, it's possible to centralize menu planning, for instance, but to have meal preparation happening as the DOE does it in 1,200 different kitchens. So and it's possible to centralize purchasing maybe, but not meal production. So it's important to be aware of all of these details and smaller level centralization that might be occurring, like what Lynn's doing across senior centers, early childhood and shelters.
And a project like the Green Market Co. is really trying to bring some of the benefits of larger scale procurement to the individual centers. Okay, I think.
Hi, thank you for the presentation. So I'm predominantly concerned with access to healthy food and affordable food for low-income communities, and also how the different components of our food system can really connect and create jobs. So it sounds like, and I think there's a lot of opportunity through institutional practices to impact, especially public institutions. So I'm wondering, it sounds like a lot of the challenge with procuring raw, fresh foods is really in processing, especially for some of the smaller, medium-sized institutions. In thinking about kind of job creation and access, wondering what innovations or growth you guys see in kind of the processing piece of the system, because we've got someone who's essentially a food hub who's trying to connect markets to farmers, and you've got folks being able to access better food. But it seems like one of the things that's disincentivizing institutions from purchasing locally, purchasing raw, is that they just don't have the capacity, the skills to work with the food in a timely manner.
The space and the knives.
The coolest thing that we've done at Lenox Hill since I've been there is take interns into the kitchen. So we take high school interns, we take co-op tech interns, which is a kind of a GED city-run program. We take nutrition. We have nutrition graduate interns, and it is an incredible win-win process. And it's a different exchange and a different skill exchange and a different experience for each of those groups. But the cooks adore it. They are able to shine and kind of give their skills to somebody younger, and the other people are able to be the hands that we need.
That
And
strikes,
it's job skill sharing.
that strikes me as a really great note on which to close, because we are at our official close. But think about the win-win. Think about the potential here, the potential to conserve our environment and enhance our environment by privileging purchases from farmers who take care of the land. The potential for improving the health. I'm going to leave with the image of it's not just the 12,000 inmates, but the families, and that they return to the community. The opportunity to improve the health of seniors and have them experience it and make changes in their own diets accordingly. It's a win-win-win situation if we do it right. And I'm really grateful to the audience for turning out on this snowy day, and I'm thinking about all the food delivery trucks in New York City that are trying to get food from one location to another where it's supposed to be prepared, and thinking about what a challenging system or non-system this is. Thank you for coming, and we will be having another good time with the